Welcome back to another episode of Pelvic Confessions. I am Dr. Carrie Howe, and this is my co-host, Dr. Jean Shirakabrad.
Welcome back to the show. On this show, we have conversations that women don't often have, but really should have regarding pelvic health and women's health.
Yeah, so I have the pleasure of having these conversations every day in the clinic, treating my women. And so we want to shed some light on these women's health issues. We're presenting the topics as confessions that women have told me in the clinic. We always omit any personal detail for sake of privacy of my ladies.
So when we have clinical conversations and to kind of bring you all into the clinical process, for us at least, we are reading research, we are discussing the latest discoveries, the latest processes, just the latest that's going on in medicine. But we also, without giving too much information, like Carrie said, we discuss clinical situations, and we have just to run it by each other, say, hey, what do you think about a presentation like this? And just doing that from a clinical standpoint makes us better clinicians, because we have these conversations and we can utilize our experience, our expertise, and our knowledge to better help our patients. And we thought that this show is a piece of that, a way for us to have similar conversations, less clinical, obviously, less jargon and things like that, but to still help you and everyone that's watching be part of a healing process through conversations, at the very least to know that an issue is going on, right? The best way to treat an issue is certainly never to let that issue happen, but if it already is happening, to know that an issue is occurring. And that's why we're having these conversations. And these conversations aren't easy by any means, right? Because when we're dealing with pelvic health, women's health, a lot of them are very personal issues. And the reason for all that is to lead into today's issue, which is incredibly personal.
Very intimate.
So you ready to get into it?
Yes.
Again, these confessions come from a patient's perspective, a patient's lens. And this one is very straightforward in terms of how it sounds, but it's anything but straightforward in a clinical approach.
Right.
And the confession is sex hurts. And obviously this is incredibly timely with Valentine's Day, which adds all the love, but when you're dealing with something so personal and painful, there's an additional burden that's pretty tough for the women, right?
Yep, for sure. Yeah, I mean, this is a very common thing that I see in my practice day to day. And I think the first thing that I want women to know is that sex shouldn't hurt. But if it does, you're not broken. You're not alone. There's something that we can do to actually help for it to become pleasurable.
That's really important. I think we have to treat it from a clinical standpoint, right? There's a clinical issue going on. If you had any other medical issue, literally anything else, you wouldn't think twice about getting medical help or talking about it. If you had back pain, the most common medical issue, like you don't shy away and go, oh, I have back pain, I shouldn't talk about this. Sure. But it seems to me that a lot of women suffer in silence when they're dealing with painful sex.
Yeah, again, when we're talking about pelvic health issues, these things could be very taboo. They can be very intimate. We don't often openly discuss our personal sex life. And then you take the other element of these women really internalizing this and thinking, what's wrong with me and my body? And again, feeling broken or feeling ashamed or frustrated.
Yeah.
And unfortunately, it's not too well known yet in terms of pelvic physical therapy being able to play a role in the healing and recovery of this. Sometimes the generic advice is just, well, yeah, use more lubrication or drink a glass of wine to relax. But there can be a musculoskeletal issue going on.
Yeah. My thought was, if that, right? If that advice is given, right? Usually when it's not even talked about, or there is no advice, right? Just deal with it or figure it out. Or so a lot of women are probably searching Google, or if they're talking to friends and they're getting second hand advice for an issue, but this is a clinical issue and typically has a clinical name to it.
Yeah,
right?
There's a whole host of different subsets of this, right? So dyspareunia is just a generic term of painful intercourse, but that can even be broken down more into specifics. There's a diagnosis called vaginismus, which is an involuntary spasm of the pelvic floor muscles to penetration. And so those muscles become very tense and they don't let anything insert, and that can be very painful.
And it's not just, that is not just for sexual penetration, right? That's like literally.
It could be for sexual penetration. It could just even be for a pelvic exam from a
Right.
GYN. Some women have never been able to tolerate inserting tampons because that's painful. Oftentimes there is a large psychological component to this because it's the body's response to pain and to fear, and it becomes this cyclical process of anytime anything has gone near the vulva or the vagina, those muscles clench up because it's almost like a defense mechanism.
Yeah, so it's an involuntary, sometimes, like you said, it's a cycle that feeds itself, right? That's a self-fulfilling prophecy in a way that it happens, you keep trying it, it keeps rehappening. But what are some things that you do when you see ladies that come in with this issue?
Well, one, again, just letting them know they're not alone.
Yeah.
Like, almost, I don't want to say normalizing this issue, but I think when women come in, they think they're the only person who has ever had this issue. They feel very alone and very isolated. And I try to encourage them. This is what I do day in and day out. I wouldn't have an entire practice built around this if you were the only person that was struggling with this. Again, we don't even have these conversations with our friends to the point that you had kind of brought up. Like, we're not chatting with our gal pals about how sex is painful. So just letting women know, again, you're not alone, you're not broken. There is a physical aspect to this. It's not in your head. That's kind of the first place to start. And then explaining what I'm going to be assessing in terms of pelvic floor involvement and scanning out and assessing, is there some type of musculoskeletal component to it? Again, oftentimes there is, regardless of if it's the main problem or kind of secondary, those muscles are involved in sexual function.
It's got to be pretty powerful to validate something so intimate and personal, especially if you are the first or one of the few to say, I hear you, what you're experiencing is real.
Sure.
And then let's actually look at ways to help. But muscle spasms, that's incredibly painful.
Yeah.
Right? Muscle spasms, to use low back again for an example, for those of you that have experienced low back pain, which is the most common medical issue, that's incredibly painful and debilitating.
Yeah.
You can imagine if it's happening in the pelvic region, that's got to be intense pain too.
Sure. Yeah. And that area is so hard to connect with for most people. We can't see it, we can't touch it, we don't often feel it. And it's easy when there's pain to just dissociate to that area of the body, but it can be very painful. And also there can also be more reasons for pain with penetration outside of just those muscles spasming. There can be vaginal dryness that is creating micro tears with insertion. There can be some integumentary issues with the skin that can be causing some inflammatory issues. So these are all things that we're scanning out and assessing during that first session. You can have pain with the vulva, right? Everybody thinks vagina is just that generic area, but it's important to differentiate. The vagina is the canal, so it's the entry point into which insertion happens, but the vulva is the external portion of it. And so it's important when we're talking about pain with penetration is, where is that pain occurring? Is it happening on the outside? Is it happening with initial penetration or deep penetration or a combination of all three of those areas? And depending on that, it helps us make a differential diagnosis in what we think is going on.
So when you are differentially diagnosing, pain tells a story as well. Like you said, there could be from the skin to muscle spasm, and they have their unique pain characteristics. What are some different sensations or pain that women feel that could be different areas?
So oftentimes when we're talking about maybe pain with initial penetration, some women will describe it some women will describe it as right when he goes to insert, it's like we have to get through a lip. And once we pass that hump, then we're good. Clinically, in my mind, I'm thinking we're probably focusing more on the superficial layers of your pelvic floor, right? If we take our model, you have muscles right here that are on the outside that wrap around those openings. And so if there's tension there, that first initial penetration can be difficult. And then once the penis is inside, it's easier. Burning sensation. So again, when we're thinking maybe vaginal dryness or irritation, burning is a common sensation or pain complaint. Reports of feeling like their partner is hitting a wall. Women and even partners can feel that limitation. If there is tone in those muscles, there's not much room for things to move around in there. And so that's a very common description of feels like when they enter, they're hitting a wall. They get blocked. They can't move. Those are a few pain points.
Yeah.
Sexual intercourse.
It's probably important to hear, right? Again, some validating sensations that they're not the only ones experiencing those things. And there's a root cause, and when you can figure out that cause, then you can figure out a treatment. So let's talk about treatments.
Yeah.
Obviously, I'm sure if women are watching and they're going, okay, that sounds like me, that's me. But what can you do to help with that?
Yeah. First step is education. I feel really passionate that empowering women in what's going on and educating them in the physiology and the anatomy gives them a sense of confidence to know what their body is doing and what is happening. And it makes it a little less scary. From there, actually treating the muscles and the nervous system. So a lot of mindfulness or relaxation strategies of connecting your brain and your body and your pelvic floor and getting lengthening and noticing throughout the day, when are you clenching those muscles and can you try to find and release those muscles? We do manual techniques in terms of actually getting on the muscle and giving the brain some input of this is the area. This is the area that you need to try to release and lengthen. We can do stretching. We can do hip opening exercises. And then depending on the severity of it, oftentimes we are encouraging our women to get on some type of dilator training routine. And so a dilator is a therapeutic device that is where you insert and you're teaching the vagina and the tissues around it to accommodate that stretching. And they will start off very small and they'll progress in size and in girth to accommodate penetration.
Well, that's great. I think it's like most things, not a linear process, right? But I think you said there's a saying, and it exists for a reason, that knowledge is power. And something like this, start to get ownership of the process and then control over the body is pretty important for something so intimate. Any closing thoughts? Anything that you would like women to know that are having pain with sex as a takeaway?
There's help. If you're having pain with sex, there is help, and pelvic physical therapy can help you to not just deal with it. And I really want to bring that awareness to it, that these issues are vulnerable and intimate, but there is hope. And I hope that we can kind of get that beacon of hope out for those women.
Yeah, I think that's so important, especially if you start telling yourself the narrative of, well, this isn't life-threatening or this isn't the biggest deal in the world. Then you're just settling for less than, and you really don't need to do that.
Yeah, as women, we're really good at suppressing things and just moving on and dealing with it and getting through it. I don't want women to have to struggle.
No, and that's why we're having these conversations. So if you're dealing with painful intercourse, there is hope, like Carrie said. Pelvic physical therapy is a great avenue for that. And if you're in the Howard County, Ellicott City, Columbia area, or Maryland, anywhere in Maryland, you can reach out to us either for a digital appointment or for an in-person appointment with Dr. Carrie. You can head over to our website at www.restorepelvicpt.com, and you can actually book your appointment right on the website for whatever works for you. You could also head over to our YouTube channel, youtube.com/restorepelvicpt, as well as Instagram at restorepelvicpt if you want smaller bite-sized content or want to reach out on Instagram and shoot us a message. We'd be more than happy to respond to see if pelvic physical therapy can help you. I'm Dr. Gene Shirakabat here with Dr. Carrie Howe for Restore Pelvic PT. We'll catch you again on the next episode of Pelvic Confessions. Cheers.
Cheers.
Heart cheers. Oh, well, it's still better than last time.
Yeah.
Where it cut out like 3 times.
Yeah.
Hit stop on that. No, it's the